All right, so one of the most common areas of the body that people ask me to explain or want to know more about is the rotator cuff of the shoulder. And one of the reasons that people ask me this is they're all pretty familiar with the term, or they've heard of it. They've heard of maybe like someone in sports who's had surgery on it, or they know a friend who's had surgery on their rotator cuff, and they know the name. Sometimes they mispronounce it a little bit and call it rotary cup or something like that, but they've all heard of the rotator cuff, but they're not exactly sure what it is. So today I want to explain to you a little bit about the rotator cuff, the anatomy, how it works, what happens when it's injured, and then how we go about fixing it. So the first thing is just the anatomy, and the anatomy is four muscles. The top one is the supraspinatis, the infraspinatis, Subscapularis, and Teres minor. Those are the four muscles of the rotator cuff. And next we'll talk a little bit about how it works. Where the rotator cuff gets its name is these four muscles that surround the shoulder blade. This is a right shoulder. This is the collarbone, the clavicle there. They all come together to form this cuff, the tendons and a little bit of tissue that surround the shoulder here. And if we take the ball out, the humerus, you can look in there, and what you can see is kind of a concave surface. There's usually a thing called a labrum around there, and the analogy would be like a golf ball sitting on top of a tee. So the rotator cuff's job is to take this ball, which is the head of the humerus, and keep it in contact with that tee-like mechanism, which is called the glenoid. And so it's sort of like this, where it's if this is the cuff like this around the ball, and this is the tee, as the deltoid goes to lift the arm and some of the bigger muscles, the rotator cuff keeps everything in contact just like that. Okay, to kind of further explain how this rotator cuff works, another way is that the glenoid in there, remember what I said, it has a labrum around it, which is kind of like a lip of cartilage that makes this cavity deeper. And it's analogous to a suction cup. And so it's the ball of the humerus sits into that suction cup, and that's how the shoulder creates some stability. And the job of the rotator cuff, like I said, is to kind of slide and glide and move that the ball around and keep it stable while the big muscles act on it. And part of how it keeps it stable is also compresses into the joint, right? So think of that as like the ball is shoved kind of into a suction cup. It creates some stability with that lip of tissue. And then while your pecs, your delts, all these other muscles of the shoulder are lifting and moving your arm, it keeps everything nice and stable. So some of the ways the rotator cuff can get injured, first off, and which is the worst, is that it can get torn. And often it gets torn just right across the top here. This bigger muscle on the top is called the supraspinatis. This area here, this is the area called the acromion, and sometimes it will go in, it'll kind of bunch up in there, or get forced into this area, and that will actually cut into the muscle and tear it. And it can happen, you know, traumatically in just kind of one episode, or it can happen repeatedly over time. And then some of these muscles do just get inflamed. They get overworked, you know, if it's a repetitive type of thing, and they can actually form like a tendonitis. And so those are the two main ways the rotator cuff gets injured. It's either torn, it gets inflamed with some tendonitis. There's an area up in here underneath the glenoid, the acromion, where there's a bursa there, and that can also cause some pain. So those are the main ways that the rotator cuff gets injured. So how we go about helping or fixing somebody who has some trouble with their rotator cuff is by making the whole shoulder structure as strong as possible. So the four muscles of the rotator cuff aren't the only muscles that act on the shoulder. There's a lot of other ones too that are also big and strong. It can help support the shoulder. And often when the rotator cuff is involved, it's not just all of them, it's just one. So the idea is there may be a deficit in one of the muscles, but we strengthen the whole shoulder, and a lot of times just strengthening the whole shoulder complex overcomes that deficit, and that helps the rotator cuff to heal. Now, if it is completely torn, a lot of times that does require surgery. It's a very kind of harder surgery to get over, just because they're sewing together tissue that has a lot of force going through it. But that's a brief synopsis of the rotator cuff. If you have any questions about it, please let me know.